There's some good news. If you have pre-diabetes, Swedish researchers have revealed most people with the condition don't develop full-blown diabetes. The study tracked older adults for 12 years. Just 13% developed the disease. Dr. Joe Kostrich joins us now. Hi, Dr. Joe.
Afternoon, Tracy.
First of all, what is pre-diabetes and what are the warning signs?
Yeah, there are no warning signs. Pre-diabetes is one of these sort of newer medical terms where you haven't got an illness or a disease. So we talk about pre-hypertension or pre-high blood pressure. It's saying your blood pressure is still normal. What's called pre-diabetes is your blood sugar level is a little bit above the normal cutoff, but it's not at a level that would be considered diabetic. So you're in that sort of grey zone. There will be no symptoms. Unless a blood test is done, you will have no idea that that is the case.
All right, so who's most at risk?
Probably people who are overweight and people who are eating too much carbs is what we've really found over the last 30 years. Now, there are genetic tendencies, and I think it's important to, again, delineate that we're talking about pre-diabetes in terms of type 2, not type 1 diabetes. With type 1, where people don't make enough insulin, this concept of pre-diabetes doesn't exist. So for people who are on this sort of path where they're eating a lot of carbohydrates, they're eating a lot of grains, their blood sugars are going up, the insulin's coming out, this whole cycle, this happens for years. Yes, all of those people, and some of it's obviously going into the, the hips and the middle, potentially at risk. It's thought to be, maybe in excess of 1 million people in Australia.
All right, well, if you do have or found to have pre-diabetes, how can you reverse the condition or prevent it? I mean, I know you mentioned a few things that you shouldn't be consuming.
Yeah, absolutely. And I think this study is quite encouraging because it's saying if you've reached that point, it's not like you're on a one-way street, it's a two-way street. You can reverse out. And very interestingly, work done by a doctor in the UK, his name's Dr. David Unwin, has found that even people who've gone through to diabetes, he's getting 53% who are getting into remission and are no longer needing medications. And he's doing that by putting them onto a lower carb type diet. So it's likely, first of all, that from this study, that maybe a lot of people, they're not going to get that way anyway.
Yeah.
Number two, it may take a long period of time. Number three, it could be a warning sign that says, well, hey, if I'm on the road to diabetes, I don't want to develop that. Are there things I can do? I can change my diet, I can watch what I'm doing, I can do more exercise, I can manage my weight, I can get better sleep. There's a whole host of things that can be done that means it becomes less rather than more likely you go down that path. It's not a given, it's not a one-way street.
Yeah, sure. Well, should people diagnosed with pre-diabetes be worried though?
Look, worry is not a particularly useful thing. We all do it. There's no point in worrying about it. I think it's really more what can you do about it. And I think this research, together with other work, says that rather than be worried or rather than think, oh, well, look, it's just a matter of time, it's like, no, there are actually things that I can do that are going to make a difference. And then it's setting about doing those things.
Always putting us at ease, Dr. Joe.
We do what we can,
yes,
Tracy,
I'm sure you
Friday,
do.
Eh?
Happy Friday to you. We'll see you soon, Dr. Joe. Thank you.
Good-o.